Hi guys, my name is Madison. I am a student dental hygienist and I love the career path that I'm on. I kind of wanted to make a video just because I noticed when I was kind of looking for a little bit more information on dental hygiene school, it was pretty hard for me to find anything online as far as what to expect and what to plan for. So now I have 6 more months left of school, yay! And I decided, why don't I make a video to help people know what to expect and how to plan if you are planning to go to dental hygiene. So I've noticed that there is multiple types of dental hygiene school. Some programs can be 4 years, some can be 2, some 2.5. The one that I'm in is a 2.5-year program, and you leave with an associate's degree in dental hygiene. So how my school is set up is we kind of do our prereqs with our dental hygiene courses together. First, we kind of get the sciences and the maths out the way, and then we just kind of add in those clinics and that dental hygiene course. Some, they kind of are, you do your prereqs first, and then you apply to the program and only do dental hygiene courses. So there's many types of school available, so there's a lot of kind of wiggle room for you and the type of person you are. If you want to just kind of focus on your prereqs first and then kind of dive in all the way into the dental hygiene courses, there's options for that. And if you're just kind of at a place where you're just like, I just want to dive all in, the 2.5-year program could be for you. I'm not gonna lie, the 2.5-year program is a lot. You know, you're having to constantly study, constantly put your social life kind of on hold, just because it is a lot of material and it's covered in a short period of time. The classes I'm in are 6 weeks long each, so you're learning what a normal person would learn in a semester in 6 weeks. So it's a super accelerated course, but it kind of moves a little quicker and allows you to be done with school before the 4-year program. So it is really nice. And the 4-year class, you're still going to leave with that associate's degree unless you kind of go longer and turn it into a bachelor's. So that is kind of an upside of the 2.5-year or 2-year program, because ultimately you're going to leave with the same degree you would if you did your prereqs first and then your dental hygiene courses. So that's something to kind of look into if you're kind of not really sure what you feel like is going to be good for you. Then just do a little research, find out what's near you, and kind of the best part of dental hygiene school is 100% clinic. So it's a super hands-on, you're learning, you're constantly meeting patients, and it's just super fun. For me, I had no dental background at all, so when they put those instruments in my hand and put me in an op, I was like, oh my goodness, this is all so new to me. I have no idea what's going on. And I'm not gonna lie, I was really super nervous, but to see what I've developed into and how much the school has taught me has been so rewarding, and it's something I will never take for granted. I had a lot of classmates that were previously dental assistants, so that was really nice because a lot of them kind of helped me along the way and kind of gave me little context clues and things like that to kind of push myself and kind of learn a little bit quicker than the book. So a lot of common sense from my peers were coming into me, and that was just really awesome because I felt so supported by a lot of people. And it just made me feel like, oh my gosh, I can conquer anything I want, and dental hygiene school is going to be amazing, clinic's going to be amazing, and just everything's going to be amazing. So the way my school has it set up is, at first you work on little typodonts, or like little fake artificial mouths, and you're using your real cassettes full of instruments, and you kind of do that for 6 to 12 weeks, learn technique, learn good ergonomics, just learn everything, all the basics that you're gonna need to learn before you go into a human mouth. The second segment is when we partnered up with our classmate, and we were able to use all of our new techniques, all of our adaptation, still use our ergonomics, but use it on each other in a comfortable setting on the first human mouth that we've ever cleaned. So that was super exciting, and it was a super like slow pace that we were able to really soak everything in and learn everything, and most importantly, feel comfortable. Like, we were able to just get our technique to where we weren't scared, and that really helped to build my confidence so much, because my classmate gave me so much feedback and allowed me to really grow in areas that I was kind of holding back because I was scared. So that was amazing. And then the third segment is actually seeing patients. And the way my school has it set up is it's just like a normal dental office. You just see patients, you schedule them on your own, and you see the patient, you do assessments, and then from there you go into making a treatment plan and cleaning the patient. So our appointments at my school are about 3 hours long. You can either come at 8 in the morning or 1 in the afternoon. And we just go through a series of multiple assessments to determine the type of cleaning you need. And then from there, we perform the cleaning under the supervision of a registered dental hygienist as our instructor. So that was very awesome, because you meet so many different type of people and you're exposed to so many things so quickly, because you really don't know who's making an appointment until they get into your op. So that was really nice for me, because it was like, no matter what day it was, you were always going to be meeting someone new, and you're always going to be testing your technique on a whole new level, because every patient is different. So with them doing that, we were able to get out of our comfort zone so quickly and really become a confident student hygienist. Now, I'm not gonna lie, with us having to have our own patients, it is super stressful when patients cancel or just decide not to show up. We've had a lot of days where patients just don't show up, and it does affect your grades. So it can be like kind of a downer when you're feeling so good about the technique that you've adopted and the new confidence you feel, and you can't show it because someone just decided not to come. So that is something to definitely remind yourself of. There's going to be a lot of things in dental hygiene school that are completely out of your control, and it's okay. As long as you're doing what you need to do and you're doing the best that you can do, then just kind of woosah. I had to learn this the hard way. I would just be so upset that it was like the end of the world, and multiple people, my program director is just like, this is dental hygiene school, honey. This is the way it's gonna go. So here I am telling you, this is the way it's gonna go. There's gonna be so many things that are out of your control, and you just have to breathe, because it's hygiene school. You're gonna be okay. You're gonna make it through. You're gonna graduate. You're gonna be amazing. You're gonna be a great hygienist. So just constantly remind yourself that it's okay. And if you need to breathe, then just breathe, because sometimes that's what you need. My school has smaller cohorts. We are groups of 15, and I've been with all 14 of my classmates for going on 2 years now. We have 6 months left together. And I can honestly say I've created amazing friendships that I see myself having for the rest of my life. I've made best friends that are always there and have my back. And if I'm having a bad day, they're going to do anything they can to make me feel happy. And they're going to just always constantly keep smiles on my face. We are always having study groups, which I strongly recommend. Don't feel like you need to go through this all alone, because whoever's in class with you is going through the same exact thing as you. It doesn't matter if you guys are verbalizing it, they are. So just kind of don't be afraid to make friends and create bonds with people and create study habits together. Because I can't even tell you how many times me and my classmates have come to class 2 to 3 hours early and studied all together, because we all feel that we all are going to make it together. There's no letting one of us struggle behind. If one of us is struggling, we all come together to help that one person. And to me, that can honestly almost make me emotional, because we've all had a day where it just wasn't our day, and all 14 of us will come together to make that person turn their day around. And to have people like that on your side 24/7 going through the same exact thing you are is such a blessing. So just don't be afraid to make friends and create bonds, even if you're kind of like a quiet to yourself person, kind of push yourself out there, because those friendships and those bonds with those people that are going through the same thing as you is really going to take a lot off your shoulders and make you feel a lot more comfortable in dental hygiene school. So that's a super, super, super recommendation of mine, is to just make friends and get through it together, because there's no better way than to. Now, with that being said, that does not mean, oh, everything's gonna be perfect all the time. You're never gonna butt heads with people. You definitely will, and that is okay, because we are human, and you are with these people more than you are even with your own immediate family. And that is not a joke. And if you butt heads, then just let it be that. You butt heads. The next day or whenever you guys calm down, don't be afraid to say I'm sorry. It doesn't have to be like a rivalry to the end of school. Like, that's not the case at all. You guys are literally a family, and it's okay to butt heads, and it's okay to say I'm sorry and forget and forgive. So that's a big suggestion of mine also. Don't be afraid to say sorry, and don't be afraid to butt heads, because you guys are family. At the end of dental hygiene school, you will have to take your national boards and your credits. So one thing I would recommend is just throughout school, kind of always be refreshing yourself on things that you've learned a while ago, whether it's math, science, anything. You're going to need to refresh your mind on those, because you are going to have to take a national boards over all of it. So that's something I super recommend. My school personally, we have a board review course where we do board review before we take the board. So I've kind of just been preparing for that, and we'll do the practice board, mock boards, and everything like that. But one thing that I've really prided myself on and been super happy about is that I just kind of, every course, I keep my flashcards, and every now and then I'll just pull out a random stack and just quiz myself on it. And if there's things that I need to remember, then I get on it, study it, and then move on, because you don't want to feel so overwhelmed with all the information you learned, whether it was 4 years, 2.5 years, 2 years, you're going to be tested on it. So you definitely don't want yourself to feel overwhelmed, because that overwhelming feeling can be debilitating and make you just feel like, I cannot do this, I cannot do this. So just, like I said, breathe. It's dental hygiene school, and just prepare yourself the best you can. If you could make it to like some sort of seminar to prepare you, I would strongly recommend that, just because they kind of warn you about what to expect, and they kind of just give you one book that you can just pay attention to, rather than trying to jump around every single book that you own from dental hygiene school and hope to God that you pull out the one fact that they're going to ask you on the board. So, and then with credits, you just have to find a patient that meets your requirements from your school, and just pray and cross your fingers that they show up. So all is good. It's all gonna be good, because this is dental hygiene school, and you're gonna do amazing, and you're really just gonna blow it out of the park. So if you are at the end of this video and you're still wondering, is dental hygiene school for me? I will personally let you know that going to dental hygiene school has been the best decision of my life, and I'm so happy that I made that transition into dental hygiene. So if you are just on the fence, you're not sure, jump in, do it. You are gonna be amazing, and I cannot wait to see you. Comment below and tell me how school is doing once you get accepted and once you start. So once again, I'm Madison. I'm in dental hygiene school, and it's been the best decision I've ever made. And I really hope that this video has helped you kind of decide if that's the career path you see yourself going on. And I wish the best to you in your journey. Bye.